Probably favorite one was the empty stocking fund. I thought that was really cool. You got to get up early in the morning and go give food to people for over Christmas break and stuff like that, and people were so thankful, and you would get to interact with them, and they were so just happy to be receiving food, which was so sweet, and you were kind of reflected on yourself and how you need to be.
One of my favorite events was Lost Sheep Ministry because I had never really done anything like that, and it was just really nice to see these people get the clothes that they needed, and it was just really cool to experience. And then I also really loved when we toured Medic because I thought it was really, really cool.
Probably the speakers coming at our meetings as well as the social focus meetings, because we get to do stuff that are not only listening, but we get to take part in the activities.
My favorite events have been the tours of local facilities. We have toured places like the Medic Blood Clinic and the Forensic Center. These tours have allowed us to look at areas that are critical to the community, but are often overlooked. So it was really interesting to see these places and get a feel for what they do. Since beginning Youth Health Board, I have learned much more about the role of various health-related careers in the community. To illustrate, we recently had an expert in nutrition come and discuss food pantries and the importance of a well-balanced diet. And so just learning more about these different careers has been such an eye-opening experience, since when thinking of health, I usually just think of doctors and the people that work in the hospitals.
I've learned a lot more about how there's a lot of limitations to people getting access to healthcare.
I think that one of the big things of learning that I've learned on Youth Health Board is really just being able to interact with the community and take leadership. It's been a big leadership. It's developed my leadership skills by taking initiative to serve the community. You learn about, like I said earlier, different health disparities that go on, and so you understand different things that I don't experience personally, and I would never know unless I joined Youth Health Board.
Through Youth Health Board, I've talked to a lot of speakers and asked questions. I think that just helps me as a lawyer, speaking up and being able to talk about different issues.
Youth Health Board has allowed me to hone my leadership and communication skills through our events like Social Focus, in which we brainstorm with our peers to try and solve problems in the community. And I feel like these skills will definitely transfer to college and my career, where I will discuss with peers and, of course, work with them to come up with solutions.
Well, I'm going to go to UT to study political science with a concentration in criminology, but I really think that being on the Youth Health Board has exposed me to different political disparities. Well, not political disparities, just disparities in general around the community. And if I want to pursue a job that's in the community, then I can address those issues.
My experience with Youth Health Board has been entirely positive. I would describe it as a great way to meet like-minded peers while also giving back to the community. And I hope to be here next year.
It was a really fun experience, and I got to meet a lot of people from a lot of different schools, and it was really interesting to learn about how different places have different health needs.
I'd probably describe it as an awesome opportunity to understand all the different different disparities in Knoxville, and be able to understand how different people are affected in different ways.